Good morning, ladies and gentlemen. I am Dr. Manoj Sharma, Head of Department of Spine and Orthopedic Surgery, Jaipur Golden Hospital, Rohini, Delhi. Today I am going to speak about a rare syndrome called the Dynamic Vertebral Artery Syndrome or the Bow-Hunter syndrome. This is a very rare disease, at times, and this is found between the age group of 50 and 70 when the person gets old, and the people who have got chronic neck pain. What happens is that when they turn their head around, especially on the right side, they start having giddiness, and at times they can even become unconscious, and they can feel as if there is a loss of power in the arm or leg, or they can even start fearing some kind of a sound in the ear and loss of hearing and that kind of thing. This is because our cervical spine has got the main artery which comes from our heart, and this is our cervical spine model. And it has got 7 bones. So from the 6th bone it enters into this hole, and this goes, and every vertebra has got a hole which harbors this artery. This is called as vertebral artery, and it goes right inside, and then it comes out from the 2nd vertebra, and then it winds around over the C1, and then it goes into the brain. Now, if we turn our head round, then this can get obstructed here, and it can be compressed because of many reasons. Like in old age, you can have the enlarged bone or a ligament, or if there is a instability, or in patients of arthritis, there can be an unstable spine, and there can be a lot of tissues which can encroach, or at times there can be a thrombus inside the artery. So all these things can cause the artery to shrink in size, and when we turn the head around, there is a dynamic occlusion. Means when we turn it around, the blood flow in the brain becomes less, and the patient tends to become unconscious. This is called as Bow-Hunter syndrome. Now, for this, we have to do a surgery where we have to, if the blockage is lower down, then we have to go from the front. If the blockage is in the upper part, then we have to go from the back. And then we have to decompress, this hole through which the artery goes. We have to decompress that hole, and then we have to fix the spine and fuse it and stabilize it. And then the patient is fine. So this can be done by the latest, very, very minimally invasive techniques. So this is a rare condition. So this is just an awareness video for the patient who feels giddiness when they turn their head round. So it can be because of this. And the diagnosis is clinched by the dynamic CT angiography, where we put a dye into the artery, and on the CT scan, it shows us that there is a constriction of the blood flow in the artery. So, thank you very much, and I wish you all a very good health and a long life. Thank you. For any spinal problem, you may contact us at Jaipur Golden Hospital, Rohini, Delhi.